Welcome to all. Myself, Sajithra, lecturer of Emmanuel Arasa College of Pharmacy. Today, I'm going to discuss about skeletal muscle relaxant. In this session, we completely learn about the pharmacological and mechanism of action of skeletal muscle relaxant. And then we see about the individual drugs which are used as skeletal muscle relaxant. In particularly individual drugs, we see about the side effect, therapeutic effect of the drug, and mechanism of the individual drugs which are used as skeletal muscle relaxant. Now we are move on to the intro part of our session. First of all, we should know about the skeletal muscle relaxant. What is skeletal muscle relaxant? Skeletal muscle relaxants are a class of drugs that reduce muscle tone and relieve muscle spasm by acting either on the central nervous system or directly on the skeletal muscle fibers without causing complete paralysis at therapeutic doses. Skeletal muscle relaxants are medications which are used to relax stiff or spasmodic muscles, which helping in the conditions like pain, injury, or neurological disorders. This skeletal muscle relaxant act either on the central nervous system, such as brain and spinal cord, or directly on the skeletal muscle fibers, and are completely used to alleviate pain, improve mobility, and manage condition involving muscle spasm or injury. Then we move on to the classification part. We should know about the classifications before we learn about the mechanism of action, because mechanism of action was based upon the classification of this muscle relaxant. Then skeletal muscle relaxant are classified into two main classes. They are centrally acting skeletal muscle relaxant and peripherally acting skeletal muscle relaxant. This centrally acting skeletal muscle relaxant act on the central nervous system such as brain and spinal cord. The drugs which are involved in the skeletal muscle relaxant are baclofen, diazepam, methocarbamol, etc. And the peripherally acting skeletal muscle relaxant which act on directly on the muscle fibers or neuromuscular junction. This peripherally acting skeletal muscle relaxant are classified into two main categories. They are neuromuscular blocking agent and directly acting muscle relaxant. This neuromuscular blocking agent are classified into two main classes, which are non-depolarizing classification and depolarizing classification. In non-depolarizing classification, there is a main drug which is known as D-tubocurane, and depolarizing classification, there is a important drugs which is succinylcholine, and directly acting muscle relaxant drugs are dandrolin. And now move on to the mechanism of action. First of all, we see about the centrally acting muscle relaxant mechanism of action. This centrally acting muscle relaxant, which act on the centrally um, spinal cord and brain, and centrally acting muscle relaxant work by depressing neuronal activity in the brain and spinal cord, which leads to reduced muscle tone. And how it will work? It will enhance the inhibitory pathway, that is GABA mediated. GABA means gamma amino butyric acid, which in which leads to the inhibition of excitatory neurotransmitter. and this action reduce the reflex activity in spinal cord, and this leads to decreased muscle spasm and spasticity. And the therapeutic effect of this skeletal muscle relaxant, which this skeletal muscle relaxant relieve the muscle spasm, reduce the muscle spasm, decrease pain and stiffness, and improve the mobility and functional activity. These are the therapeutic effects which involve in the centrally acting skeletal muscle relaxant. Side effects. There is a common side effect for this centrally acting in skeletal muscle relaxant, which are drowsiness or sedation, dizziness, muscle weakness, and fatigue. These four are the common side effects which occur in the administration of centrally acting skeletal muscle relaxant. Other other side effects are hypotension. Hypotension are particularly occur in the administration of tizanidine and dry mouth, and confusion which are occur only in the elderly people, and dependence also a major side effect when the administration of drugs like benzodiazepines, and these are the common and particular side effects which occur in the time of administration of centrally acting skeletal muscle relaxants. And then individual drugs which involves in the centrally acting skeletal muscle relaxants. First, we see about the diazepam. Diazepam is the major part of the drug which are placed in the centrally acting nerve skeletal muscle relaxant. Mechanism of action of diazepam is which enhance the GABA A activity. GABA means gamma amino butyric acid, which this diazepam enhance the GABA A activity, and this action which leads to the CNS depression. And the use of this diazepam is muscle spasm and anxiety. This diazepam are most commonly used in the time of anxiety. Adverse effect of this diazepam. This diazepam will cause the dependence, and it will cause the sedation also, because diazepam is most commonly used in the sedation drugs. Then we have to see about the baclofen. Mechanism of action of baclofen is this baclofen act on the GABA B receptor. Diazepam act on the GABA A, and baclofen act on the GABA B. This baclofen acts as a GABA B receptor agonist, which leads to the inhibition of spinal reflexes. And the use of this baclofen is it reduces the spine spasm when the time of spinal cord injury. Adverse effect, this baclofen also cause sedation, and it will cause a little bit weakness also. And then move on to the peripherally acting muscle relaxant. This peripherally acting skeletal muscle relaxant uh, works outside the CNS, and mainly at the neuromuscular junction or directly on the muscle fibers. Mainly this blocks or works on the neuromuscular junction. And then neuromuscular blocking agents. These neuromuscular blocking agents are the type of peripherally acting skeletal muscle relaxant. This peripherally acting skeletal muscle relaxant are classified into two main types. They are neuromuscular blocking agent and directly acting peripherally acting skeletal muscle relaxant. First, we have to see about the neuromuscular blocking agent. This neuromuscular blocking agent blocks acetylcholine action at nicotine receptors. It prevents the neuromuscular transmission. This prevention leads to the muscle paralysis. These neuromuscular blocking agents are classified into two main classes. They are non-depolarizing classification and depolarizing classification. The main drug which involved in the non-depolarizing classification are D-tubocurin. This D-tubocurin which combatate agonist of acetylcholine. And another one classification is depolarizing classification. Example for this depolarizing classification is succinylcholine. This succinylcholine persists in the depolarization and which leads to the prevention of depolarization. This is the short outline of this classifications and then move on to the individual drugs classifications. Non-depolarization agent. D-tubocurin is a main drug which used as non-depolarizing agent. Mechanism of action of D-tubocurin. First of all, this D-tubocurin combates as acetylcholine and antagonist. This action leads to no polarization, and this no polarization will leads to no muscle contraction, and this no muscle contraction which leads to skeletal muscle relaxation. And this is the process when how the skeletal muscle relaxation will occur on administrating the time of D-tubocurin. This D-tubocurin is most commonly used in the time of surgery for relaxation of skeletal muscles. The common adverse effect of this D-tubocurin are hypotension and histamine release. And then move on to the another classification, depolarizing agent. The common example of depolarizing agent is succinylcholine. The mechanism of action of succinylcholine is the succinylcholine produces a persistent depolarization, and this persistent depolarization which leads to initial fasciculations, and this initial fasciculations which leads to receptor desensitization, and this receptor desensitization which leads to flaccid paralysis. This is the mechanism of action of succinylcholine. This is the outline how the succinylcholine produce the skeletal muscle relaxations. The common use of this succinylcholine is it is used at the time of surgeries also, and the ADR of this succinylcholine is hyperkalemia and hyperthermia. These two are the common adverse effects which are observed on the administration of this succinylcholine. And then move on to the final classification, directly acting drugs. This directly acting drugs also the classification comes under the classification of peripherally acting skeletal muscle relaxant. This directly acting drugs act directly on the muscle fibers. This directly acting drugs which inhibits the calcium release from sarcoplasmic reticulum. This leads to reduced muscle contraction. Dantrolene is the most commonly used direct acting drugs. This dantrolene are most commonly used as peripherally acting skeletal muscle relaxant. The mechanism of action of dantrolene is this dantrolene acts on the skeletal muscles and which inhibit the calcium release from the sarcoplasmic reticulum, and this process will reduce the acetin myosin interaction. This acetylmyosin myosin interaction is required for the skeletal muscle contraction. If this activity is inhibited or reduced, it automatically uh, reduce the contraction. If the contraction will reduce, then the muscle relaxation will be happens. This is the outline for the mechanism of action of dandrolin. Then this dandrolin is most commonly used in the time of hyperthermia and some muscle spasms. The common area which are observed in the time of administration of dandrolin are muscle weakness and liver toxicity. These two areas will be observed at the time of dandrolin administration. And we have to conclude our session. This is the conclusion of our this classes. Skeletal muscle relaxation plays an important role in relieving muscle spasm and spasms in various clinical conditions. While they are highly effective, they use their use must be carefully monitored due to potential side effects such as sedation and respiratory depression. Appropriate drug selection and dosage are essential to achieve safe and optimal therapeutic outcomes. Now our session is over. Thank you for listening my session and attending my session patiently. Thank you.